The effect of height and mass on musculotendinous stiffness of the lower extremities. A presentation by Andrew Kitcaff. Stretching is widely accepted as an injury prevention technique and is often thought to promote better performance in physical activities. However, some researchers propose that acute muscle stretching may be detrimental to performances in which success is associated with maximal force or torque output. This is supported by similar studies which suggest that a stiffer muscle is more efficient in absorbing and releasing energy imposed by surface impacts. Research leads one to believe that an optimal level of stiffness can exist for maximal power output, with studies revealing that increases in leg stiffness are positively correlated with faster stride frequencies and running velocities. Leg stiffness is an elastic component of the muscle-tendon complex, which is referred to as musculotendinous stiffness, or MTS. A high stiffness value relates to the ability to absorb, stock, and release energy that is produced by the mechanical strain of an impact. Excessive MTS can be related to an increase in peak forces and shocks, enhancing joint stability, but also the risk of bone injury, while insufficient MTS may be linked to excessive joint motion and instability, resulting in soft tissue injuries. A number of studies have been conducted on muscle stiffness between genders to establish if differences exist. One study hypothesized that males must recruit greater leg stiffness than females in order to drive their larger body mass, suggesting that body mass directly relates to MTS. The purpose of this study was to determine whether a difference occurs with MTS as a direct result of increased body mass, using body mass index as the predictor. Measurements of leg stiffness were established by requiring participants to perform one-legged hopping on a forced platform. Participants were required to hop barefoot on their dominant leg without prior warm-up. The hopping frequency was set at 2.2 Hz on a metronome, and throughout testing samples, vertical ground reaction force was recorded over a 5-second period. 42 college students volunteered to participate in the study, and they were separated into 3 groups according to their body mass index rating, which was calculated using their height and mass. Groups were equal to or less than 24, 24.1 to 26, and 26.1 and higher. On completion of a successful trial, participants' peak force was recorded and used to calculate leg stiffness values. 2 single-factor ANOVAs were used to determine whether a significant difference existed between groups using BMI and leg stiffness as the between factors. A post hoc test was required to further establish significance between groups. Table 1 represents the groups, means and standard deviations for peak force and leg stiffness. Included in the table is the mean scores for the total study sample. There was a significant difference found between groups for peak force produced. The post hoc analyses revealed groups 2 and 3 being significantly different from group 1. Group 2, with the BMI of 24.1 to 26, produced the highest mean peak force in the study, recording over 20,000 newtons on the force plate. Group 3, with a BMI of 26.1 and greater, recorded the highest mean leg stiffness value of 148.7. There is limited research on the influence of body mass on MTS, with disregard for gender. Therefore, the purpose for this study was to distinguish any differences between the 2 variables with a sample population of both males and females. There were significant differences present between groups, resulting in rejection of the null hypothesis, suggesting that leg stiffness does increase as a result of elevated body mass. Included in the results was a moderate relationship with increased force production and BMI. The one-legged hop test was selected for the study, as it has been shown to produce excellent test-retest reliability. Muscle stiffness is essential for the maintenance of joint stability, with both mechanical and neural influences on joint stability. trainability and familiarization of MTS is achievable in order to improve performances and prevent certain injuries. The participants of this study had various sporting backgrounds, leading to suspect differing levels of trainability in their lower body muscles. BMI is a simple, non-invasive measurement that can be administered with ease. It is a reliable measurement that can be used on a global scale with its international standard in calculation, despite having limitations in validity. Body fat percentage, on the other hand, can distinguish between fat mass and lean mass in individuals. However, a limitation to body fat percentage occurs when administering the measurement, as there are multiple methods available, each varying slightly according to the equipment being used. A focus for further study should be on the group of participants, standardizing groups to a specific set of characteristics such as gender, training history, or injury status. With these variables, standardized results may produce more significant differences between groups, revealing a closer relationship in regards to MTS and the individual. In summary, any increase in body mass of an individual may result in a stiffer muscle of the applied limb to aid in joint stability and injury prevention. Musculotendinous stiffness directly relates to body mass due to added pressures and forces being applied and can be influential towards physical performances where maximal power output is required. The one-legged hop test can determine the risk factor for injury by evaluating the amount of active stiffness and stability in the limb. Measures of MTS can be implemented in training schedules for high-performance sports in order to monitor an athlete's improvement over a period of time. An individual's BMI may need altering in order to achieve an optimal level of MTS to enable maximal power output in a chosen activity.